I just want to welcome everyone to the last national webinar of the Yes Center. I know it's pretty sad, but we are ending our 5-year journey with the Partnerships in Systems Change, our Partnerships in Employment Systems Change, or PI Systems Change grants under the Administration for Community Living's Administration on Disabilities. And it is very bittersweet, but I will just say how amazing it is to see the wonderful progress of the 6 states that we've had the pleasure of working with, also with the original cohort of PI grantees that came before the Yes Center, and seeing the continued great work of that cohort, and then working with all of you. We currently today have over 500 participants in what we label our Yes Center National Community of Practice. And ever since about a year ago, when we started taking a concerted effort to taking all of the learnings and successful strategies and emerging innovative models that we've seen out working with the PI grantees and exploring in other states, bringing it to you in a virtual format to try to disseminate and share and learn from one another. I think we've had a great ride. It's been a wonderful year. I think we've had some compelling, amazing stories from self-advocates, from family members, from direct professionals in the education, employment, and community living sectors. And I just really want to say thank you to everybody who made it happen. Number one, first and foremost, we need to thank our federal funders, the Administration for Community Living and the Administration on Disabilities, for which without them, we would not be here providing all of this great content and access to these amazing thought leaders and subject matter experts. I also really want to thank Transcend, our technical assistance partner, under the leadership of Dr. Laura Owens, and with the support of Sean Roy, my partner in crime as the co-project manager this year of the Yes Center, as well as today's moderator, Dale Verstegen. This is a dream team. We absolutely love working with them. We learn so much. They bring so many valuable insights and expertise and people into our work. We can't do this work without partnerships. And I think everybody knows that systems change doesn't happen in a vacuum. And we certainly have gained so much perspective from having Transcend and their network of partners throughout the country be a part of this work. And I want to thank Tash for really being such a strong voice of bringing to life and lifting up the voices of self-advocates with intellectual and developmental and other significant disabilities, and really making sure that the work we do is extremely intentional and focused on looking at ways and strategies to really elevate the socioeconomic potential and fully optimally independent living of these young people as they enter into adulthood. So with that, I just wanted to say thanks and say that it's, again, bittersweet, but we're so happy to have such a wonderful webinar, talk about exiting in style. We have a wonderful webinar planned for today, and it's my great pleasure to turn this over to Dale Verstegen, one of our national subject matter experts, who is going to introduce our panel today and set the stage for what's going to be a really lively, interactive discussion related to employer engagement. So thanks again, everyone, and we'll have some reminder or some final thoughts at the end on how you can continue the work with Yes Center after the end of this contract. So with that, I'm going to turn it over to Dale.
Great. I want to be sure you can all hear me.
Yeah.
So good. So welcome everybody, and very excited that we have this opportunity today to end this series with employer engagement. Employer engagement is key to the systems change efforts that has been going on with all the PI grant states around the country. And today we have the opportunity to hear from some employers, along with disability in representatives who really have a long, strong history of working with and partnering with employers. So looking forward to all of you having a chance to kind of hear from these folks. So as you can see on the screen, these are the folks that are going to be part of our panel and presenting. And we're starting out today with Darla Wilkerson. And what I'm going to do is ask Darla to introduce herself and the two employers that she has brought in to make this presentation. And then afterwards, we'll hear from Katherine McCary and Ryan Walters, who will then talk about their works in the DC area. So with that, I'm just going to turn it over. And this is informal. It's not intended to be a formal presentation with PowerPoint slides and so forth. It's meant to be more interactive and discussion. So please, right from the get-go, offer any kinds of questions or comments that you'd like in the chat. And again, if you have specific questions for the panelists, start putting those in right away so that we have that kind of library of questions that you all have that you would like to have us all address once you get done listening to what they all have to say. So with that, I'm just going to turn it over to Darla and get us started on the first presentation. Darla?
Great. Thank you, Dale. Thank you, everyone, for inviting us to be here today. I'm Darla Wilkerson. I'm the Executive Director here at Disability Inclusion of Greater Kansas City. And for those of you that may not be able to see me, I am a white woman. I have gray hair, wearing some reading glasses with a blue shirt and the Disability in Greater Kansas City logo behind me. So glad to be here. And I'm going to just start a little bit about what we do here at Disability in Greater Kansas City. And then I'll introduce Carolyn and Andy and have them talk a little bit more about what they do. I kind of handpicked these two folks because I think they have amazing stories to share about their work and the involvement that they've done in the community locally, as well as, you know, some other outreach efforts that they've been involved in. And I've known each of them for quite some time and been able to work with them in a couple of different capacities. So hopefully we'll be able to share some great nuggets for you to take away today. I love that you're ending your 5 years with this session around employer engagement, because I think it's one of the most important pieces that you can pay attention to. And if you go forward in doing continued systems change, hopefully employer engagement is in the forefront of everything that you do. For me personally, I've been involved in employment of people for disabilities for about 35 years now. And I've been in many different positions throughout my career, even working in a state system for a while here in Missouri. And been involved in working directly with people with disabilities early in my career in terms of helping them look for employment, doing training, consultation, lots of variety there. But I have to say, my last 6.5 years here with Disability in of Greater Kansas City has been an amazing journey to really be able to work with business and closely with business to help them advance their disability inclusion efforts in the workplace and marketplace. Disability In here in Greater Kansas City is an affiliate of National Disability In, if you didn't already know that. There's about 25, 26 of us around the country. You'll hear from one of those other ones here. I want to hear in a little bit with Katherine from DC. And our mission, even though we all operate differently, we are our own nonprofit organizations, our missions are the same, and that is to work with business to help them advance their disability inclusion efforts in the workplace, marketplace, and supply chain. And we do that in a number of ways. This organization here in Kansas City has been around since 2009. We started with a handful of employers here. Andy used to work with one of those AMC theaters years ago, and they were one of the starting founders of this organization to really get some efforts and some teeth around disability inclusion. When many companies have their overall diversity and inclusion strategies, disability many times is left behind or very, very minimal. And so a focus here that is still business led, we have a 14-member board of directors, and they're made up of representatives throughout the Kansas City area and beyond. And their passion is to guide this organization so that it continues to be a business-led organization. So a peer-to-peer approach to how to advance and elevate disability inclusion. We do it in a number of ways. We have tools and resources. We have consultation that comes along with our services to businesses. When they come in partnership with us, they're investing in this organization. They are becoming a part of this employer-led group. And so that investment oftentimes is a way to share with the community that they are an employer of choice for people with disabilities. They start with looking at their internal process. How do we do this through a cultural assessment to take a snapshot of where companies are at on their journey, and then be able to provide some guidance and consultation that helps them create and design strategy that fits with their disability inclusion efforts. That strategy oftentimes leads to training of their workforce, training of the hiring managers, training of recruitment, talent acquisition, all of the pieces that need to come into play to make sure their internal workforce is prepared then to have external messaging and begin to actively do outreach and recruitment for individuals with disabilities. So many things that come into play with employer engagement, but I want to let you hear from a couple of folks that are really involved in this work, and not only as a partner within Disability In, but within their particular organizations. And so I'm going to turn it to Carolyn and Andy. Carolyn Magruder is recruiter with Children's Mercy Hospital here in Kansas City, and she's been very active in her role, coming up with very creative ways, and especially this past year and a half, of how does she continue to put disability inclusion in the forefront. And she's also a board member with our organization, so perfect fit for this conversation as well. And Andy Traub is with, he's a VP of Human Resources and Inclusion Works with Allied OneSource. And Andy is not only, a senior leader in HR, but he's a senior leader in disability inclusion. And Andy and I have been able to do a lot of different projects together, a lot of presentations, a lot of training. And it's a pleasure to have him here as well as Carolyn. So I'm going to turn it over to you two. I don't know which one of you would like to start, but I think just maybe sharing a little bit about where you are as a company, where you are in your particular position, and how you feel that employer engagement piece is important when it comes to disability inclusion.
Sure, I'll go ahead and start. So thank you, Darla, for that introduction. So I am Katherine McCary, Children's Mercy Community Outreach Talent Recruiter here at Children's Mercy. So I'm out in the community in every aspect. So trying to engage current employees by meeting them where they're at, so participating with different events with our affinity groups, also our employee reference groups, depending on what organization you're with, and making sure that we are engaged with those groups from looking at different pieces of their events, their professional development. I've been here at Children's Mercy so about 7 years. So during that time, our engagement has kind of gone up with those events. I've been in recruitment for about 20 years. So how we have changed kind of our perspective of how we do and recruit talent. So if we're going into the junior highs, if we're going into the colleges, partnering with business partners, having Darla and her team have been gracious enough to come and help with us creating trainings for different pieces from the accommodation standpoint, meeting trainings, for the hiring managers so we can hire staff that has different disabilities within our organization. So we are looking at different ways that how we approach the kind of the recruitment process and how we engage our employees within the organization. So we're reaching out from doing mock interviews at the high school level. So I also recruit for a program called Project Rise here at the hospital. So what that does is for patients that have been previously patients here at Children's Mercy with disabilities that are transitioning out of teenagehood into adulthood, partnering with them and different business partners as well to try to have internships built in. So with those internships, then they will acquire skills that can either be hired into certain roles. So if it's maybe supply chain, distribution, environmental services, customer service, and then doing those mock interviews with them as well at that either high school level or that kind of freshman year of college level to help them transition into those career roles or those job roles and getting them into the organization. I also work with a couple of different school districts here in Kansas and in Missouri for our project search. So then meeting with them as well to help them start internships, to help them do mock interviews, creating those future pipelines. So typically those students and teachers are not quite sure, where do we, send these kiddos that they can again go and work with these different organizations. So working with them to let them know about different opportunities that we have within healthcare that they may not be aware of. I mean, we are, as a hospital, kind of like a small city, so we have over 3,000 jobs on all levels. So with that, we have different opportunities for someone to come into the organization and then work with us on all levels. So we're kind of thinking outside of the box and how we recruit. 2 weeks ago, we went and partnered with a local coffee shop and ice cream bar here in Kansas City that typically hires people with disabilities. So we partnered with them and we're on site then to hire people of all ages, of all levels. So from entry level all the way up to degree positions. So we sat on site for about 8 hours and about 2 weeks ago to meet with employees, to meet with parents, to meet with future employees, to talk to them about different opportunities within our organization, to let them know, what we can do if they're not quite sure where to start, helping them kind of look at those different pieces of, okay, where would be the best benefit for you? Is it a part-time? Is it a full-time? Is it for a Kansas location? Is it a Missouri location? Having those conversations with them about job coaches. When job coaches are allowed onto the site, especially with COVID, they had lots of questions about that, if they were still able to have those job coaches, what the training looked like. So having those conversations with the parents and then the future employees. So we are definitely, I think, thinking outside of the box and how we hire people with disabilities and then bring them into the organization so they can be successful and then grow with the organization as well.
Yeah, and as you guys can hear, Carolyn is, like she mentioned, thinking outside the box. She is always, I'm so impressed with the things that she gets involved in, and as you can tell, very involved in doing outreach and in the community, not just waiting for someone to apply. She's actively seeking out people, and specifically people with disabilities and youth with disabilities, and helping prepare people for their future. And I just love that. And Carolyn, I know that you shared with me a while back about when COVID first hit and trying to change some of the strategies on how people apply for your positions within the hospital. And so could you share a little bit about the video recording and interviewing, how people were able to do that, and share with how it went to all recruiters, not just one particular person to look at?
I sure can. So we created a program called Introduce Yourself. It's done through a platform called HireView. So our job board can be a little verbiage driven. So instead of trying to decipher through 500 jobs on different avenues from allied health, nursing, customer service, we have an opportunity for someone to go to our website. And if they don't see what is there on the website, they can opt in, and it'll ask them 2 questions. What have you done, and what would you like to do for Children's Mercy? And then that information can be a video. If somebody wants to upload a video, typically it's like 5 minutes, if that, and they can do it on like their smartphone or laptop, desktop, tablet, any of those options, or they can opt in with a resume, or they can do a LinkedIn profile. So giving people options of kind of the different media platforms that they're comfortable with. And then that way we can kind of see where would be a best fit for them. So instead of them trying to apply to 40 different jobs that they may or may not be qualified for, just because our job descriptions sometimes are not the most user-friendly outside of the organization when you're looking at the verbiage. So changing that dynamic, and then those videos and that LinkedIn profile, those resumes go out to all 10 recruiters. So we then all have access to that information. And I can tell you there's a lot of times that I'm like, oh my goodness, I just saw this video. Guys, what do you think? We have to hire this person. And having those conversations like, okay, where can we place them? And then it's kind of a fight with the recruiters of, okay, I'm going to call them about this job. I'm going to call them about this job. And then we're all reaching out because we found this really great person and we want to have them, be a part of the organization. So then we're telling them about all the different opportunities. So we encourage them to apply for all of those positions, because ultimately it's, that candidate's decision of where is the best fit for them within our organization. So we always want to let them know about all the different opportunities that we have available. So HireVue has really kind of changed the face of how we've been able to bring people into the organization, because it's really opened our diversity and our inclusive factors, because, we do have accommodations through HireVue. We're able to have all of those pieces where, previously it just was our standard process of our old system of just sending your resume in. Well, now with the HireVue piece, it's given access and accessibility where we didn't have that with that introduce yourself component. We've even changed with COVID now with the video interview. So instead of, having to worry about having to come on site, and then our HR department is not located at the hospital location, so then you have to be shuttled and worry about parking. We've changed how we do that. So now there are live video interviews that you can do from the comfort of your home through HireVue. So we're really kind of making sure that we bring those pieces of accessibility using our technology in the best way we can. And if somebody's not able to, you have access to that that video at home, then we can bring them on site to our HR office, and they can do the video and do the live video on site in our human resources office. We've done that as well. So if someone doesn't have access to Wi-Fi or technology, I've met people multiple times in our office to have them do that live video interview with the hiring manager in our HR office, because then maybe the manager's not here locally. Maybe they're off site, since we do have a few locations between Kansas and Missouri. We've got 22 locations. So that way they're still able to interview with that manager and then still have a good experience, because they're using the technology that we have right there on site.
Yeah, and that's amazing. And I hope folks can kind of gather from your passion and how you're sharing this, that this to me is a little unique, because a lot of places have a tendency to think only about certain positions that might be right for people with disabilities. And you all are really, stretching this to make sure that people understand all the positions that you have to offer and where's the best fit. And even if someone doesn't understand all the positions that you offer, you're trying to help them learn more about those. And I just love that approach. So thank you for sharing that.
We're happy to, because that way it kind of changes how we hire people. It changes how we're able to then give those options, because when you just submit a resume, you're not able to really convey that person's experience or that skill set or their passion. Maybe they have a certain experience that they've had personally with Children's Mercy, and they've always wanted to work in our oncology floor or our emergency department, but they're not a nurse, they're not a doctor, but they want to work there. So it's talking to them about all the different other ways that they can be employed at Children's Mercy with different positions that maybe they're not clinical, they're not those positions that require that certification, but they're still benefiting the organization.
Absolutely. So I know people have questions for you at the end. So I'm going to turn to Andy now. So, and Carolyn, I may ask you a couple others here as we go forward. But
Sure.
Andy, I would love for you to share from your perspective. I know you've got some rich history in your 8 different HR positions, but also just a little bit about Allied One Source too, and how you're really focusing more holistic, and some of the kinds of things that we do with companies. You also are doing that, and still maybe share a little bit about that and how you value the partnership with this organization as well.
Well, thanks, Darla. First of all, I'm a white male. I do have hair, but it doesn't look that way. So I have a nice forehead with a glare off of it right now. I'm in my home office, surrounded by books and a desk. So I have a typical home office setting behind me. Wearing glasses. I have dark shirt on, and in spite of the 97-degree temperature outside, I have a sport coat on, just for, make sure we look it on camera. So anyway, yeah, so my background is 25 years human resources. It started out in, smaller and worked my way up through the corporate ladder. Had the opportunity, as Darla mentioned earlier, to work with AMC Theaters and create the AMC Focus program, which is a program for AMC that was intentional about going out and hiring individuals with disabilities to work in the theater. Started out with autism as our baseline diagnosis, and then made it universal. Had a universal design component to it. And within the first year, we had about 800 individuals going through the program at that point in time. Happy to say it's still a thriving program, even 12 years later. So since then, I've, once I got into the disability employment space, I found my profession of being in HR turned into a passion, which is helping individuals knock down barriers to employment, and especially in the disability space. And then have been in this space now nonstop since then, and thoroughly enjoyed my time working with Disability In. And ironically, that's one of the reasons why I'm actually doing what I do now. Darla and I do have go back, and we have had a lot of conversations. And in Kansas City, we are in a unique position because we actually do straddle state line. As Carolyn mentioned, we have the Missouri and we have Kansas, and that's been, even though we talk about the Civil War being over in 1866 and 1865, it's still very much a problem to have state line run right through the middle of Kansas City for funding reasons, opportunities, people not being able to go from one side to the other, the state line, especially individuals with disabilities. So I actually engaged a staffing firm that I started my career with 25 years ago to ask them if they'd be interested in starting a venture to where we might be able to span the state line and create opportunities for individuals with disabilities to work with all the clients that Allied had and has. And so that's what started Inclusion Works. And Inclusion Works was really an opportunity for us to try and change the model to a certain degree, and work with providers to create pipelines of talent, of qualified talent, into the thousands of jobs that we have open on a daily basis, and then help employers understand, you can put the idea out, I want to hire individuals with disabilities, but are you ready to do so? And really preparing their culture, their policies, practices, procedures, the things that Darla had talked about, really kind of sitting back doing an introspection. And so I think it's one of those interesting pieces about the fact that being able to have the desire is great, but are you equipped to be able to handle it? And so that's one of the big things I think about Disability In, is because it is a thought leader and a thought instigator in Kansas City. And Darla, having been around for such a long time in our community, and having worked in so many different areas, it really is a convener of thought of, we're all kind of in this together from an employer standpoint. And I think that's really kind of helped slowly changed the landscape of Kansas City. It's not easy when you're dealing with two different types of states, very different states in themselves. But so I think that's part of it, is people are understanding that there can be change, and we're not asking people to hire people because of charity. Our mantra is it's the same job, same pay, same expectations. It's not the what that has to get done, but maybe the how can be changed. And so it's doing a lot of education. I've, enjoyed, working with Disability In, helping present, but also they get really great, presenters to come in and speak to employers, and there's different types of learning. So it could be a small group. It could be, and I've been on calls where it's like 4 or 5 of us, but it's rich conversation. Or it could be a larger group. We have the Thought Leaders Luncheon, which was yesterday. And, it's people sitting there saying, we're passionate about change. How do we go do this together and collective? But then we even have the summits, which happen, on a yearly basis, where we have, yes, there's some of Caroline will be there, and I'll be there, some of our own, people who are wanting to make a difference. But then we also have it's a great opportunity for people to just come get introduced to disability employment. And I think that's one of the great things that we have, that, within Disability In. It's showcase what you're doing, but also is an opportunity for you to, learn from others. Everything from, like Carolyn mentioned, we have video interviews. We do video interviewing as well. We work with our clients, which are our businesses. And by the way, all of our services, none of them cost our candidates a dime. It's all paid for by the employers. And so the technology that we have is similar to Carolyn's, where we can actually now have, video interviews, which will substitute for a first interview, sometimes even substitutes for a second interview. We even have some people who the first time on site may be their first day to actually go. Now, one of the things that we certainly advocate for, and as a best practice, is the opportunity for people to have realistic job previews, to be able to see as much of the job as possible. We've even gone so far as having our account representatives and our salespeople, when they're on site, if they get permission from the employers, just use their cell phones and take many videos of where the person might be working, or the environment they may be in. We leave the sound on so you can tell if it's loud or if it's dimly lit or whatever. And so we're using some of that video technology to help us educate candidates. But then on the other side, to Darla's point, it's also educating businesses. And so that's what we do. And that's Inclusion Works, Allied One Source. And that's what we do. And it's been a lot of fun. And so, yeah, our partnership with Disability In is, I know Darla's, always asking me about our affiliation, but it's priceless. I mean, it really is. I enjoy it. Our company knows that's a partnership that we need to continue to have. It's not only brand recognition, but if you look at the who's who in Kansas City and employers who are wanting to make change, that is certainly an organization. Children's Mercy Hospital always is there. Allied's always there. We have Cerner. There's so many different businesses who get together. So collectively, I can't even tell you, because Carolyn mentioned the fact she has 3,000 jobs. We have 1,000 jobs. I mean, collectively, how many jobs are represented by Disability In Kansas City is enormous. So anyway, that's a little bit who I am and what I do. And again, thank you so very much for the opportunity to present today.
Thanks, Andy. I think the richness of your background and your experiences now with companies is amazing as well. One of the things I think, you guys both mentioned the enormous amount of openings. I think one of the questions we had early on was, what are employers doing coming out of the pandemic, or what are we experiencing that employers are struggling with, or what are challenges? And I think that's one of the biggest. I think anybody on this meeting today would say that everybody's hurting for talent. Everybody's hurting for employees right now. And that's what we keep seeing. And I think our biggest challenge as an organization is to continue to get candidates in front of the businesses, to help. We see ourselves as a connector. And so we're helping connect the two. And while we don't serve individuals directly with disabilities, we do work with community organizations, that support individuals looking for work. And we also have our online job board that, it's called Jobsability, and John Robinson with Our Ability is the creator of that site. It's a great tool for people to use to connect, candidates with disabilities to employers, because it's specifically designed for candidates with disabilities. So all of those tools and resources are really what's helping folks get connected, but we've got to continue our efforts, be very intentional about how do we connect to the candidates that are looking for work, because those openings are there. And I keep saying, if we can't help somebody with a disability find a job right now, gosh, what are we doing? We're in trouble if we can't get folks employed right now. One of the questions, I think maybe this is for both of you, but I see in the Q&A, if it's okay if I just throw that out real quick. Somebody wanted to know, how do your efforts to recruit and match people with disabilities with jobs intersect with other efforts to support people with barriers to employment because of race, gender, sexuality, and et cetera? So any of you want to tackle that one?
Yeah, I can certainly do that from an inclusion work standpoint. We do talk a lot about individuals with disabilities, but then my experience is the fact that disabilities, we talk about very segmented disability areas, but the other part about it is that we also have other segments that, in that list, you're also talking about, should include veterans and veterans with disabilities. And then also fair chance, people coming back from incarceration that, we've all probably seen studies to where like the number of individuals with disabilities and the incarceration, there's a huge overlap. So it's almost more of, when you're knocking down a barrier, it's not, I'm going to knock down one specific barrier for employment for this individual because they have a disability. It's more of, it's a holistic approach to where, I was a young man when, Ronald Reagan told Mr. Gorbachev to tear down the wall. And I feel like that's kind of what we do is a little bit, is when we're trying to tear down a lot of barriers at once, and we can either hit them with, very, our efforts may be well intended, but if we're only beating that wall with a cast iron skillet, like I've seen people do in the Berlin Wall, or you sit there and you can be the bulldozer. I'd prefer to use heavy equipment. So it's more of it's a holistic approach to be able to sit there and say it's bringing individuals who are qualified, and it's talking about the qualifications for the job, not about personal side or what they can or what you perceive you can't do. It's almost more of like helping us understand the job descriptions, asking for essential functions of the job, and that essential functions can be carried out by this individual who's qualified. Again, none of it's ever being hired for charity, because that doesn't work, but it's more of what's your job require, can this person be qualified, and breaking down those stigmas. So I think, with us having kind of this approach of the veterans, individuals, with disabilities, service disabled veterans, and people coming back from incarceration, it's a very broad brushstroke to help individuals. But yes, it's important. There are a lot of barriers that we put up as a society for individuals to succeed. And I just look at, and Allied looks at it this way: if we can get qualified people in the jobs, then that's what we're supposed to do. So.
Excellent. Carolyn, you have anything you want to add to that?
Yeah, I would say, I know for us, we've looked at various barriers over the last 16 months. So is it transportation? Is it childcare? And trying to address those different areas. So I know through the primary hot part of COVID, we noticed that there was a lot of employees calling in because of childcare. So we opened an on-site childcare facility for our employees to then bring the kiddos that were doing virtual learning to a safe environment where somebody was, there was actual employees there. That way our employees didn't have to worry about calling off for childcare. So if it was transportation, then looking at, okay, how do we get employees to the organization? Is it a shuttle? Is it trying to provide them a service? I know Enterprise offered a service for employees car share, then they were able to car share through Enterprise. So looking at those different barriers of what was the problem that our employees were not able to either get to work or remain employed. And then how do we address those barriers to make sure that we continue to have our employees stay and then grow with us. But then also looking at, there's always going to be barriers for employment, but also, looking at what can we fix to make sure that we can have this person come in and be successful. So then it's also the education pieces too with the hiring managers. Have they been successful in this role before? If they have, and we can offer accommodation that's reasonable, then let's do it. Let's get them into that role. And then we've transitioned 3,000 jobs to virtual and remote and hybrid over the last 16 months. So we've kind of changed what that job looks like. So making it more accessible so someone can be comfortable and have all of their resources at home versus trying to figure out, do we have the space? Because sometimes we're a little limited on space on our different locations. So those key pieces of how to make sure that we're meeting those different barriers and kind of changing those different barriers.
Yeah, good point. All right, Dale, I don't know how much time we have left, but I'm going to turn it back to you because I see you're on camera now. So we can answer questions at the end if we have time as well.
Absolutely. Darla, Carolyn, and Andy, thank you so much for this excellent information. And already some questions are coming in, and encourage you all to, before we move on to DC, if you have some questions, post them in that question and answer section. And I failed to describe myself, so I want to correct that and then turn it over to Katherine. So I am a white person with gray hair and beard in an office setting with a multi-colored black and white Hawaiian style shirt. So with that, I want to turn it over to Katherine McCary and to Ryan. And Katherine, could you start by introducing your folks and then going into your presentation?
Sure, absolutely. Well, with me is Ryan Walters. I'm Katherine McCary. I am an older white woman with long hair, with wearing glasses and a green and white striped dress, sitting in my dining room, and behind me is a view of the lake. But if you are looking closely, you will see occasionally painters up on ladders. So that's my backdrop today. We are going to be sharing information about the DC Metro chapter of Disability In. We are responsible for the DC, Northern Virginia, and suburban Maryland location. Even though Dale did not want a PowerPoint, I needed a PowerPoint. So on the slides, you'll see that we were established in 2006. We won the Affiliate of the Year in 2012 and 2017. And our website is there, di-dcmetro.org. So the next slide. Just a little bit about me. I've been in this disability space for quite some time. I was the Chief Disability Officer for SunTrust Bank, which is now going to be Truist Bank. And I was the founding chair of what's now called Disability In. So I come from an HR background and a diversity background and served on the board of what was then DC Metro Business Leadership Network. And then when I retired from SunTrust, they all asked me if I would run the chapter for them. I am a person with a non-apparent disability. I'm a parent to 2 adult children with disabilities. And over the past many years, including this year, I've been a caregiver to family members with disabilities. If you go to the next slide. So Ryan, if you would please introduce yourself. Ryan sits on our board of directors, and I think maybe if you could just tell everyone a little bit about your role and your position, then I can run through some of the questions that were asked of us, but then I would love it if you would just chime in and then focus on really what Deloitte's been doing, if that's okay.
Absolutely, Katherine. And so excited to be here, everybody, today and share a little bit more about, what we're doing in this space, what Deloitte's doing in this space. So as Katherine mentioned, my name is Ryan Walters. And before giving you that background, I do want to just give you a description, of myself. So I'm a white male in a light blue polo. And I've got a virtual background in back of me. In the top left-hand corner is our logo of Deloitte. And in the right-hand side of the screen is a graphic that says "Working Together." As Katherine mentioned, I sit on our board of directors for our Disability in DC Metro affiliate group, and been in that role for over a year now. And I work at Deloitte, providing, you know, a lot of expertise to our clients within the healthcare sector. So a large amount of my work is not just what I do delivering work to our clients, but it's also, you know, how do I help continue to grow our firm? And that takes a few different forms, but the two primary ones that I support are advancing disability inclusion, and then also supporting our veterans and our veteran outreach and strategy. And there's large overlap, a lot of intersection between those two topics. As you know, we heard about a little bit earlier within the veteran population. So it's something that I'm extremely passionate about. You know, I'm extremely glad to be involved with the Disability In organization overall, because it allows us to connect with different employers in the space and share a lot about, you know, what we do as a consulting firm. So additional background on myself, I am based out of the Washington, DC area. Our direct practice at Deloitte focuses on the federal government. So supporting most of those federal government agencies that everybody knows well. And again, you know, my focus is directly our healthcare clients, you know, overarchingly supporting disability inclusion from the hiring of very talented individuals within this space, to you know, training of our teammates at Deloitte, to, you know, advancing priorities and setting strategy around how we can continue to really, you know, drive progress for both our firm and our clients related to disability inclusion. So a lot of different things that we're involved in, but I don't want to get too deep into that, because I know that it'll naturally come out in some of the questions that Katherine will be running through, but excited to share more in just a second. So Katherine, with that, I'll turn it back to you.
Thank you so much, Ryan. If we could get to the next slide. Just to give you a perspective of our chapter, we have our board of directors listed up here, and we are an acronym city in the Washington, D.C. area, but GDIT is General Dynamics IT and General Dynamics Mission Systems, EY, Deloitte, of course, JBG Smith, Northrop Grumman, Booz Allen Hamilton, Mars, BAE Systems, Marriott, and Gallaudet University. On the next slide, we have an advisory board. So our board is limited to employers, with the exception of Gallaudet University, private sector employers. But we use our advisory board to bring in talent from other companies and also be able to expand our subject matter experts who may come from nonprofits. So for our board of advisors, we have Lockheed Martin, the Valuable 500, Leidos, Maxar, the ARC of Northern Virginia, Concepts Communications, which does a lot of work with the Office of Disability Employment Policy, iYellow, which is an interpreter service and captioning service, the Resource Network, which is a disability-owned business, K&L Gates, which now has hired the former OFCCP, Office of Federal Contract Compliance Program Director, Craig Lean, KPMG, and Sandy Spring Bank. The next slide. So one of the questions we were asked is, well, who are your members? And we approach membership with the fact that everyone has something to offer. And I know that Darla spoke about collaborating and being a part of the community. So years ago, the Business Leadership Network, now called Disability In, was limited to private sector employers. Today, that's changed gradually, but fortunately for the best, because now we can engage with all different types of individuals and organizations that have some value and want to offer their expertise and want to learn. Just like Greater Kansas City, we look at benefits for our members for thought leadership, knowledge exchange, which is probably the most important thing that we see. An opportunity for both internal and external showcasing. We just did an event yesterday, a webinar event yesterday about deaf and hard of hearing. And we had the president of Gallaudet speak to us and talk about what they're doing at the university. We are strongly committed to collaboration and education. And I know Darla mentioned branding, which is an extreme benefit for members of the disability in family, because employers want to be known and recognized as disability inclusive. I wouldn't say any employer would say they understand everything perfectly, but by branding with our website and by featuring them in webinars, we're able to tell the community of individuals with disabilities, yes, Deloitte wants to hire people with disabilities. That's why they're a part of this organization. And yes, Deloitte wants to retain individuals with disabilities. That's why they're a part of this organization. So it can drive talent to companies that are our members. Along with everything else that we've been dealing with around COVID, we put together a COVID resource page on our website. It was in our newsletter, but it got longer and longer and longer. So we just devoted a section to our website specifically for COVID resources for individuals with disabilities. We do webinars, which we transitioned due to COVID from in-person meetings. And we found our audience is broader because of the webinars, but we do miss that in-person connection. And then a monthly newsletter where we can talk about articles, showcase new things that are happening in the world of disability inclusion, and also promote events that are happening all over the United States and even beyond. So the next slide. One of the questions was, well, how is the DC Metro helping with hiring? And do our employers really work to hire people with disabilities? And yes, and I would say that for our membership, well, again, no one would say they figured it all out, but they are all proactively recruiting, retaining, promoting, accommodating, and working with our partners and our providers. There is no need to explain the value of including people with disabilities to our members. The value for them is to understand things that are happening in the disability inclusion space. What's one company doing that the other one can learn from? Especially with COVID, we've had a lot of conversations about masks and vaccines, as everyone else had, and bringing people back to work, and what will that look like? And of course, with the Delta variant, there are some changes now that perhaps 6 weeks ago they weren't thinking of. So it's always being on top of things. I would say we also focus on understanding the difference between apparent and non-apparent disability. Someone's acquired a disability, because most of us do that as opposed to being born with it. Self-disclosure and self-ID, which is different, but the majority of our employers are federal contractors. So self-identification campaigns are important. And then I would say without exception, all of our employers have some sort of disability employee resource or business resource group. So they utilize our training and educational opportunities to get those ERG members involved. So next slide. I think that I might ask Ryan to talk about this. I listed a few things on the slide that are pandemic concerns, and they're not limited to a disability organization. They're everybody's concerns these days. But safety, employee engagement, masks, no masks, vaccine, no vaccine, working remotely, working in the office, and then disclosure issues of potential disclosure of I've had the vaccine or I have not. Those are all conversations that we have. Ryan, do you want to stand in on for anything about the things that Deloitte's been doing regarding this?
Yeah, absolutely. So obviously this is top of mind for so many employers, right? So for the last over a year now, most organizations out there have been remote that have that capability, and that's to protect employees, right? And now we're starting to think about inching back towards reopening across the next few months. All of our employers are, but I think about those pandemic concerns, and I think about all of the what does this actually mean in terms of our employees with disabilities. When we transition our workforce overnight from in-person delivery to virtual delivery, there's so many things that pop up that were not necessarily things we were dealing with when we were in person, but the technology that's layered on top. We just have to be a little bit more cognizant of what's happening. So what I think about related to some of the pandemic concerns that we saw was, one, how do we make our information technology accessible to people with disabilities? We're using Zoom today, this platform. I can't tell you how great this technology is to really collaborate through. But it's continued to be a learning experience and evolved to really make sure that all of the tools, we know how to use that. And we have access to things like closed captioning, like we're seeing today, the live captioning, the ASL interpreters, making sure that we have all of those ingredients together. It's something that, being in person, the thought process is totally different. But it's something that we need to think about every single time we're thinking about large webinars through avenues similar to this. I think in terms of other things that we're seeing, I would say that making sure that employees feel supported is something extremely important to us. I know Katherine mentioned self-identification being a very important initiative for especially federal contractors. But I do want to put a fine point on that, which is, even during the pandemic, I think it's gotten even more important. And the reason for that being is that I see self-identification as the top of the ladder to be able to connect our employees to the resources, to the learning, and anything else that they need to do their best work. So that point has been underscored in a remote environment where we, some of those extra stressors that weren't there yesterday are now, even more apparent. So, those kind of things, I would say as well, are something that we've seen a lot during the pandemic, and it's continued to be top of mind for our team.
Thank you, Ryan. If we can just go to the next slide. I wanted to give you a sense of what types of webinars that we provide. And these are really topics that have been chosen by our board of directors. They change based on what's happening in the day-to-day world. But because we're in DC, we're very fortunate to have federal agencies who will present to us on what's going on regarding disability inclusion. We have an Autism at Work engagement partner. We just finished one on mental health conditions. And as you can see, employee resource groups, entrepreneurs and supplier diversity, accommodations, assistive technology, veterans, campus outreach, caregivers. And during COVID, we specifically reached out to our partners who are in the nonprofit disability space and invited them to have webinars that we promoted to all of our members on what they had done to pivot for their services and how they made it through so that they could still supply support to the individuals with disabilities that they serve. And of course, part of that was also donate to these organizations to help them do that. And then really just the last slide is something that if it's recorded, you'll be able to see. These are some of the resources that we provide, and I'm not going to go through them, but these are some of the resources and partners that we will work with so that anytime that we talk about a particular topic, we provide this to our members. And our webinars are all captioned and ASL, as well as they're on our website. So if you don't go to a particular webinar, you can still see them on that. And we will be, absolutely dealing about return to work issues, how it affects individuals with disabilities. I can absolutely foresee that as a topic we'll be dealing with in more of a panel discussion to see who's doing what. So that's really what I wanted to share with you on disability in DC Metro. But Ryan, do you have any other comments that you would like to make? And we could just go back to the first slide. That would be great.
Perfect. Yeah, thanks so much, Catherine. So I think that I do want to dive into a few areas, and I know that we want to leave time for Q&A, so I'm tracking on that. So I think a few things that I want to highlight is, coming out of the pandemic, right? What does this look like in terms of the support that Catherine already mentioned related to disability and what it means to our organization specifically. So I think there's many different things that are extremely valuable to us, and similar to what you heard from the Kansas City team. Those, I think, benefits are very similar. I think the open dialogue that we have with other employers is possibly the most valuable thing that I could really ever experience. And the reason for that is we can hear, especially during a time like the pandemic where there is so much unprecedented change, we can hear from other employers and talk about, well, what kind of roadblocks might we be encountering? And together we can kind of talk through, well, what are strategies maybe that we've implemented that you could also implement, and the same goes in reverse too. So it becomes that shared partnership of we're all in this together, and that's, I think, what I love most about the disability inclusion space. It's a lot of businesses is pretty competitive, but disability inclusion is something where you'll see businesses come together and try to overcome a lot of the historical challenges or needs within the space, and doing that collectively, which is really an impactful thing. And then I would also say the other thing that has been extremely helpful to our organization and will continue to be following the pandemic is webinars. So the ability to join into our webinars and hear from experts, whether it's within the DC area or more broadly than that, is, I think, just incredible. Again, the experiences and the knowledge and understanding that other folks have, to be able to share that across is extremely important, and ultimately it makes for better solutions, for better approaches that we come up with collectively to support everybody within the area. So that's one thing I did want to highlight, Catherine. And I think the other thing I do want to just quickly highlight is some of our I guess efforts around hiring employees with disabilities. So as has previously been mentioned, the hiring of individuals with disabilities, it takes a very direct strategy. You can't just say, I'm going to hire and we're going to hope that we get the best talent pool. It's that we have to really think strategically from the start about how the organizations that we work with, and the approach that we take once we go out and start working with those organizations, to be able to really create a great environment where we can match individuals with disabilities to exceptionally well positioned opportunities at our company. So I think one thing that we've done, which we're extremely excited about, is having launched an Autism at Work program, which is within our both our consulting and our advisory practices, and those are two really big pillars of our organization at Deloitte. And we collaborate with different groups, Specialistern being one that I can think of, and local community agencies and universities to really enhance those sourcing efforts that I had talked about. And we've gone ahead and built really autism friendly assessment processes where our candidates are evaluated, assessed, and then selected, leveraging those real custom processes that work for the applicants and are something that we can make sure that we're matching them to the best areas of our business. And then, through that program, we offer successful candidates a paid 12-week internship with job coaches along the way to make sure that they have all the support that they need. And, upon the successful completion of that internship period, they're offered full-time positions at our company with really no break in service. So our Autism at Work program is really exciting that we've gone ahead and stood up over the last few years at Deloitte, and we're continuing to just expand what we do in that area. But I think it really highlights kind of what we're doing around recruitment, and it's something that I'm as an individual, extremely proud to be involved with and to help our team out with. And the last thing I want to say here really is, as I mentioned, this takes a lot of different forms from all these different organizations that we're able to work with. Disability In is a very key one for us, both at the national level and at our DC metro local level. But also we have partnerships with Careers in the Disabled magazine, and the Autism at Work Summit, and National Business and Disability Council, and the Discardi Center. So just a lot of different things that we're engaged with, because we want to make sure that folks have more avenues, not less, to find us, and we're able to match them to the right opportunities once we do connect together. So that's just a quick snapshot that I wanted to share, Catherine. So back over to you.
Sure, thank you so much, Ryan. And actually, I think we can go back to Dale.
Great. Well, thank you, Catherine. Thank you, Ryan. And I'm going to ask all the panelists to turn on their cameras and unmute, and we'll start to go into some questions. And my initial question is to you, Ryan. When you talked about being autism at work, and you referenced this kind of customizing processing of their applications, is that customizing of those applications specific to posted types of job descriptions, that you're really trying to kind of uncover their abilities to do those jobs? Is that how it's intended?
Yeah, so we're definitely looking for their strengths, and when we talk about strengths, it's not just things that that individuals are good at; it's things that energize them. So that's extremely important to us. But it's also about abilities. What do they think they need to be successful? So it's looking for those types of matches, and finding the right position that we'd have.
Good. So there were two questions in there, one from Veronica McGee and one from Alan Bergman, that were similar in nature. And what they were asking about is, when it comes to posted job descriptions, it sounds like there's a lot of creativity in terms of recruiting, and even considering them in terms of the hiring process. Have there been any efforts when it comes to flexing the job descriptions in such a way that might also allow for certain people to be considered where they might otherwise not fit into an entire posted job description? anything being done along those lines, it's in line with, you know, more of the customized employment principles that are starting to be advocated for, you know, across the country. And I guess I'll let anybody kind of start that. So Andy, I think I saw you go first. So
yeah, so that's a great question. One of the things that we're actually finding a lot of as we work with our clients, the employers, is that when we get job descriptions, a lot of them have not been reviewed in a long time. They're legacy job descriptions, and those themselves, most oftentimes, one, are not necessarily reflective of the current state of the job, but two, there could be language, there could be things in there that are biasing that job towards a certain way, right? So, you know, the old adage of accountants need to be able to lift 60 to 75 pounds. Well, that was because they were having to lift bankers boxes. Now everything's done electronically, and it's kind of you know, it's not necessarily needed anymore. So I think that part of our work has been to go and ensure that job descriptions are as inclusive as possible, which is sometimes just updating them. But then on the other hand, it's also when we receive job descriptions from clients, it's asking, what are those parameters? Like, is this, there's essential functions of jobs, and then there's the preferred functions or the preferred qualifications. You got to go with the essential functions. The preferred is, I'd much rather have a opinion of what that person might look like. So we start to whittle away some of those preferred, or at least sit there and say, well, what about this or that? And so it's a conversation. Every job description that comes in, we evaluate versus like, okay, you know, because I think Ryan even stated, it's like, what's your strengths? What are the strengths required for that job? And what are those, you know, the unnecessary, how do I put it, intangibles that people just throw in there, because it's like, well, that's what the person who's doing it now has. And so I would say that it's just more of us going through and really sitting down and evaluating the job descriptions themselves, and they do become more inclusive when you refresh them.
Others, anybody else want to? Yeah, Carolyn?
Yep. So what we've done here at Children's Mercy is actually we've changed our job descriptions to be more inclusive. So we are now utilizing a software that changes the verbiage that is in those job descriptions, making sure that they are inclusive. We're also looking at the job requirements. So instead of, you know, do they really need to have a master's degree? Can they really have maybe an associate's and 5 to 7 years of experience? So looking at, does that degree really match with that position? So would they need a bachelor's or a master's for maybe an office coordinator, versus maybe they would just need that 5 to 7 years of experience? So we're having those conversations with those managers, and like certifications with like information systems. So, I mean, a degree is kind of irrelevant in information systems, IT roles, where the certification is really what's relevant. So updating all of those positions to reflect the certifications, because the certifications are going to be accurate every 90 days versus if someone starts a degree and a bachelor's degree in information systems today, and 4 years from now, it's going to be irrelevant. So looking at, you know, kind of how the market has shifted as well, to make sure that we are looking at each and every job description to change and put that inclusive verbiage in there, and make sure that those requirements are actually reflective of those positions. We kind of had the same thing with our patient account rep. You know, it had in there, must be able to lift a 60-pound, you know, box of copy paper. Well, I couldn't even tell you the last time that's transpired at one of our locations, where everything's digital, and it's been digital for a very long time. So, you know, updating those job descriptions on those main ones that are on our system that maybe haven't been updated in, you know, the last 3 to 5 years or 10 years. And then changing that to make sure that it is more inclusive, and that actually is reflective of the job at hand versus the job that it was, you know, maybe even a year ago or 2 years ago, and what that job looks like now.
Yeah, thank you, Carolyn. Darla, go ahead.
Yeah, I wanted to add too. I love Andy talked about the changes as well. You know, since we've all seen this remote working in many of the companies that are in partnership with us, we've seen people, you know, posting more jobs online through the online job board, and listing them as remote. And some now are saying even permanent remote positions, because they've discovered that, you know, I mean, you guys have all heard this too. Many companies are now saying, oh, these jobs can be done from home. that we didn't ever think could be done before. So this really opened up a world of opportunity for people with disabilities, but also for employers to attract people with disabilities from all over the nation or globe. So it's really created a lot of opportunity. Those that come in through our job board, we, Andy talked about analyzing those job descriptions. We've made recommendations on some of those as well, because we'll see some of that, like Carolyn was talking about, maybe requiring these upper level degrees that may not necessarily be appropriate for those positions. So I think the more we can have that conversation and talk about when's the last time these were updated, I think people are paying more attention to that. I've also seen a lot of companies in partnership with us over the past year, especially back in 2020, take the time to do that because they had the time to be able to look at those job descriptions. And the fact that those positions were now being done differently, it led to paying attention to them. So I think that's really, I mean, if you want to look at positives, that was another positive we saw with the pandemic, that employers did take the time to do that because they saw it being done differently and effectively.
One of the other, anybody else have, for anybody else want to talk about the first question about customizing the way jobs are structured? Anybody else have anything?
I just
else?
had one last thing, Dale, is the fact
Sure.
that, to Darla's point, is that there was time that HR teams, after we kind of felt like we were in the Wild West of things changing literally on a daily basis, be able to sit down. I would like, and one of the things we've been talking to some of our employers about is because you're not having as much on site, and especially considering the past 24 hours, again, we're kind of going back into the things are moving on a regular basis. Now we're, the mask mandates are coming back, and, we're not necessarily going to a shutdown, but we're kind of going back halfway to some of the stuff. So you're not able to get on site. Is to actually in the job descriptions, we've actually started having some of our employers actually put in the environment. So describe the environment in which you're going to be working in, whether it be an office environment. We've even asked, is it a hot environment? Some of our jobs are light industrial that don't have air conditioning. Well, you need to be aware of that before you apply for the job. So it's another way to give a little bit more of an insight into the job itself, to either select myself in or deselect myself out, to say this is a job I really want. And then of course we have the videos that we're trying to get more of. It's just not as easy, but I think the more information we can give about our jobs as employers, or we can pull from employers, it's going to help us to really look at our individuals with different abilities to help match them up to, again, to what are your strengths? What do you really want to do? And what do you want to do? I think Carolyn's got the great thing is like, what have you done and what do you want to do for us? Mm-hmm. That's the same type of thing, but I think we need to give them more information of what the jobs are versus here's the essential functions and good luck with the environment.
Point.
Good. One of the many things I was excited about hearing you all talk about were the internships. And I think those internships really are a less formal, structured way to introduce people into an organization where I believe then they find a way to make them fit if they like the person and they like what they can bring to the company. How are you funding those internship programs?
We've done it a couple different ways. We work with Full Employment Council here on the Missouri side and have funded through for sterile processing. We've done cohorts for certified nursing assistants. Then we have funding through the school districts as well for our project search. They are funded through the North Kansas City School District and then the Blue Valley School District on the Kansas side. So those fundings then do allow for the internships. So we're working wherever we can to try to build those internships and have that funding, if it's grant funded, or if it's coming through the federal government funding through Full Employment Council. And then we've also worked in the past with Kansas workforce as well to try to get funding for the Kansas side.
Right. I think for the folks on here, knowing how to help get these things set up, I think is really good information.
That's your workforce development offices, yeah. Full Employment Council and Kansas Workforce Partnership. Those are your workforce development offices that have those funding grants.
Good. Others mentioned internships. Any offering in terms of how those are funded? No? Okay. Well, another question did come in is entrepreneurship and small businesses are important. This is by Bob Lancaster. And viable source of employment and independence. Have either the disability inns invested in programs or resources, or have ideas on engaging small businesses or entrepreneurial resources?
We have not done a lot of effort in that arena. Doesn't mean that we couldn't. We've just, most of the people that, companies that we're in partnership with are large to middle-sized corporations. But we're growing all the time. We're improving in the types of services that we do get engaged in. And so it's definitely something we'll probably have as part of our future as well, because we know that's important. We do try to help promote disability-owned businesses to our corporations in terms of through the supplier diversity programs. But we have not engaged in supporting people in startup and small business.
So in DC, we have, although it's been start and stop off and on based on whatever's happening at the time. But at one point, we were committed to holding an event at Gallaudet because we had partnered with them the year before for their Deaf Entrepreneurship Network event. And so our thought was that the next year we will expand that so that it would obviously be more than just deaf entrepreneurs. And then COVID struck us, and so we have had to put that back. We have had at least 3 programs over the past 4 years that focus on disability-owned businesses and startups. And we have some luck in finding some of those companies and bringing them together. We have plans to do a webinar in January on the Viscardi Center's Entrepreneurship Center for people with disabilities. We postponed it to January because they're going to have some of their graduates of that program speak. And we're hoping that that will help bring the dialogue along. One of our board members, who is a certified DOBI, disability-owned business, chairs that committee, if you'll call it the committee. So he's always focused on what can we do to get more people involved in from just the entrepreneurial side and then from the supplier side. And one of the things that we found, I think maybe we've done 4 or 5 years of these programs, but one of the things we found is that not all the supplier diversity people are in Washington, DC. They're all over the country for our corporations. So by doing it in a webinar, that enables us to reach more of those companies' supplier diversity folks. So we're excited about that opportunity.
Great. And probably this will be the last question, but Thor Halverson was asking, are they incorporating deaf space architectural designs? And
I saw that question. I don't know what that means.
Yeah, I was going to say, it's only fair if you understand the concept. And I was just kind of fishing if anybody does understand the concept, then has a response for that.
I do.
Yeah.
Great.
I was just going to say that, we certainly, when we were talking to candidates who may be deaf, we make it a good point for them to understand the environment which they're going into, and then also do a little bit of education to the employers. Like, this person is not necessarily going to be the best, putting somebody in a cube and not being able to have any sort of interaction, other than just email or immediate texting, on, IM. It's almost, what type of environments can they utilize a conference room more often? Can they work in a larger, more open space? Or if they are cubes, can you have the low walls versus the higher walls? So it helps facilitate conversation. So those are some of the things that we talk about when we do have an individual who is deaf going into an environment.
I think that helped a lot of us just in terms of understanding that better. So thank you, Andy. So I want to really just wrap this up with, first of all, our heartfelt thanks for you to taking the time and effort to put this together, and congratulations on all the great work that you're all doing in this effort around employment for people with disabilities. And a final comment is, the ADA exists for one main reason was the fact that we have been able to document discrimination in the hiring process for people with disabilities that fostered the ADA to come together in the first place. And now we've been with ADA for a really long time, but what I'm hearing here are a lot of efforts to offer more flexibility and more accommodation all through the process, whether it's recruiting, hiring, and supporting the folks. And so just want to recognize all of you for really kind of carrying that banner that really started with the ADA legislation that occurred so long ago. So with that, I'm going to turn it over to Serena for some closing remarks.
Thank you so much. If we could just put the slide deck back on again. Chairman, if you can go down a couple of slides to our announcements, right there, perfect. I want to just again echo Dale's comments. What a great panel. I learned quite a bit listening today, and I'm sure others did as well. We're getting a lot of great feedback in the chat. So everyone, round of applause, virtual applause for our panelists today. And thank you so much for your time and contributions. And thank you, Dale, and Darla for pulling all this together. Just some important reminders. We ask you to please still take our post-webinar survey. This feedback is really important to us, and we want to hear what you thought of today's session. Also, if you have a burning desire to keep talking to some of these folks, a couple of our presenters will be available Friday during our office hours from 12 to 1 o'clock p.m. Eastern time during on Friday. And you'll get the reminder again, another reminder to be looking on your Yes listserv. It doesn't require you to pre-register. You just use the link and come on and join us. And typically those tend to be smaller groups of people that come in. So it gives you a great opportunity to get some free advice and some free consulting from some great thought leaders in the field. And then last but not least, please check out our website regularly over the next few months. We are going to be keeping this open, the Yes Center website open probably for a few more months. And then we'll be transitioning a lot of our resources over to the new AOD funded Disability Employment TA Center. So we don't lose all that wealth of content. But that being said, we have a number of technical resources coming out over the next few months, or few weeks, sorry, that are going to be really helpful and instrumental in your continued youth transition systems change efforts. So please keep on the lookout on those. And then just last but not least on the next slide, we just again want to say an incredible thank you for being a part of our community for the past 5 years. We've really appreciated your involvement, your dedication and commitment to improving the employment outcomes of youth and young adults who with significant disabilities who are transitioning into adulthood. We salute you and the important work you're doing, and we really look forward to finding other ways to continuing our collaboration in the future. So thank you again for being here today, and I hope everyone continues to have a wonderful week. Thanks again.
And Serena, just correction, the office hours on Friday, July 30th, it's from 11 to 12:30.
So we got that wrong. So I hope everybody's listening. Thanks, Chairnet. So the office hours are actually from 11 to 12:30 Eastern time on Friday. We must have had to move those this time. So 11 to 12:30, be looking on your listserv, mark your calendars, and come and join us. It's a great opportunity to brainstorm and bounce some ideas off of today's panelists. So thanks again, everyone, for your contributions, and have a great week. Thanks.